Hi, welcome to today's webinar, Putting the FIP Puzzle Together. I'm Dr. Vicki Thayer. I've long been involved with the topic of FIP and also involved with the Every Cat Health Foundation. Dr. Gogolski and I are excited to be part of this important presentation. Next slide. A huge thank you to our sponsor, Dr. Wendy Novikov, and our partners and friends at CFA and TICA, and honors to all the researchers, pet parents, and pet friends that are fighting FIP. Today's webinar offers the opportunity for matching donations up to $2,000 toward funding FIP research. Much of what you hear today comes from the research the foundation has supported over the past 5 decades. You can text CATS to 833-985-2287 to donate. Next slide. The presentation portion will be approximately 60 minutes in 5 parts. We will be covering pathogenesis, clinical signs, diagnosis, treatment options and prognosis, and then following with questions and answers. You can put your questions during the webinar in the chat section on the right side of the slideshow or question section. And after the webinar, you can email any questions to FIP@everycat.org, and we will do our best to answer your questions within a timely manner. During my part of the presentation, I will be on audio only and not video since my internet connection can be unstable at times. 5 handouts are available now on the right side for downloading that Dr. Niels Peterson provided for this webinar, and he has this out for other organizations too. You will need to download these during the webinar. Next slide. Remember, you can donate to the BRIA Fund for FIP research and have your donation matched. Your impact is crucial in fighting and defeating FIP. Text CATS to 833-985-2287 to donate. Next slide. I'd like to introduce my colleague, Dr. Susan Gogolski. She and I are working together on other FIP projects, and I think we make a great team. Dr. Gogolski has been on the board of the American Association of Feline Practitioners, and she's a diplomat of the American Board of Veterinary Practitioners in the canine feline practice area, and also a credentials chair for the organization. She's a published researcher and is also on the AVMA's Veterinary Schools Accreditation Committee. I turn this part of the webinar over to Dr. Gogolski.
Thank you so much, Dr. Thayer. I really appreciate the fine words you had to say. Next slide, please. Okay, so first we're going to talk about the pathogenesis. Do we know how this disease is caused? Next slide. The image on the slide represents a feline coronavirus. Note the characteristic petal-shaped projections called peplomeres that protrude from the viral surface. These peplomeres are what's responsible for the crown-like or corona appearance to the virus and where it gets its name. The peplomer proteins also allow the virus to attach to proteins on the host cell surface. So feline coronavirus occurs in 2 pathotypes based on the biological behavior: feline enteric coronavirus, FECV, and feline infectious peritonitis virus, FIPV. Both viruses are identical with regard to their antigenic properties, except for a single mutation, but they also are different with regard to their pathogenicity. FECV mainly replicates in enteric or intestinal epithelium. It is highly contagious. Typically, cats get infected through feces from a cat who has a harmless feline enteric coronavirus infection. Most of the time, the infections are asymptomatic. However, it is possible for the cat to have a mild diarrhea of short duration. Previously, we thought that the feline enteric coronavirus infections were confined to the intestinal tract only, and that FIPV was the one that would be going systemic. But we now know through research that the feline coronavirus can have a systemic component, although the viral loads for it are much lower than in cats who actually have FIP. FIPV mainly replicates in the macrophages and monocytes, and it's not infectious via the feces, but it develops from a mutation of the avirulent FECV within the individual cat that leads to the fatal disease of FIP. The FIPV biotype is believed to originate within lymphoid tissue regional to the FECV infection. Next slide. So there's been 3 factors implicated in the development of FIP: host factors, viral factors, and environmental factors. On viruses, it is still unknown which exact genes harbor the mutation leading to FIP development. Host factors, there's definitely an increased incidence in cats that are 2 years of age or younger. Some have noticed a predisposition of intact males, while others haven't. As far as breeds go, incidence of FIP within pure breeds is more likely related to bloodlines than to the breed itself. So therefore, in some countries, they're speculating there may be some unknown specific genetic risk factors rather than it actually being a breed predisposition to FIP. Concurrent disease aggravates the situation such that if they have feline leukemia, feline AIDS, if you're immunosuppressed, and then the big contributor is their immune response, whether they have a humoral versus cell-mediated immunity or a combination of both. Environmental factors. This is something that Dr. Thayer is going to be touching on later. And what they found is that there are some stressful events that seem to be associated with FIP development, and such like adoptions, recent surgeries, spays or neuters, vaccination. Also, if there's just a change in social hierarchy in the environment, if they've had a upper respiratory infection, they've shown that stress basically increases glucocorticoid production, and so this causes a decrease in cell-mediated immunity and lack of virus clearance, so by negatively impacting the T lymphocytes. Stress has also been shown to accelerate the rate of viral replication in the individual cat by increasing the generation of viral mutants supporting FIP development. Cats originating from multi-cat settings are more likely to develop FIP based on their degree of exposure to the feline coronavirus. So if there's high numbers of cats, frequent introductions or reintroductions in the environment, mingling of cats that are going to cat shows or breeding facilities, what the presence of chronic feline coronavirus shedders is, and the amount of disinfection in the facility. In catteries, factors that have been identified as being associated with an increased risk of FIP are the individual's cat age, is coronavirus titer, overall frequency of coronavirus shedding, and then also the proportion of cats in the cattery who are chronic feline coronavirus shedders. The incidence of FIP in shelters seems to be directly correlated with the number and density of cats, along with how long they're held prior to adoption, such that, the longer they're held or the higher the numbers, the increased incidence. Next slide. On this slide, what we have is an image of the FIPV. The top one represents the actual organization of the genomic part of the feline coronavirus, while the bottom is a schematic drawing of the viral structure. You can see that there's single-stranded RNA surrounded by several structural proteins, and these become important, especially the spike protein, as far as in association with the development of FIP. RNA viruses, which the feline coronavirus is, have a high mutation rate because their viral polymerase lacks proofreading ability, and so it's prone to errors. This predisposes to a high mutation within a single isolate, as well as the ability to undergo recombination between viruses when more than one infects a cell. So, increased replication leads to increased mutations, and this term, which is referred to as quasi-species, which is a group of related genotypes or a cloud of variants. So cats with chronic infections of feline corona have ongoing virus replication and present the perfect scenario for mutations to occur. Now, a mutation occurs in certain regions of the coronavirus genome and always occurs in the same genes, but the exact location varies. So efficient replication for FIP development, however, the coronavirus must be able to replicate in the monocytes and macrophages. Next slide, please. Okay, so here we have the coronavirus genome, more a closer view of it. And so what we're looking at here is there are 3 specific types of mutations responsible for the FIP biotype. And if you look at the illustration, you can see 2 are in the spike gene and 1 is in the 3C gene. So both of those are on the right side of your screen. What they found that mutations in the furon cleavage site in the spike gene and 3', which is on the right side of the image, of the accessory 3C gene are unique to each cat with FIP. However, the remaining spike gene mutation is conserved in over 95% of the FIPVs. The big deal about this, these mutations are what are responsible for a profound change in host cell tropism from the mature apical intestinal epithelium in the lower bowel to the specific class of monocytes and macrophages found around venules and surfaces of intestinal and thoracic organs, mesentery, omentum, uveal tract, and in the meninges and epiderma, the brain and spinal cord. Virus replication is typically most intense in the fully mature macrophages. So the virulence of the virus, the viral load, and the cat's immune response are what determine whether FIP will develop. So the spike gene mutations may indicate FIP, and you'll hear later that that is one of the diagnostic tests that can be run. However, what is problematic is there's a lot of variation in the spike gene compared with the other structural protein genes. So it is difficult for a lab to make primers when we're trying to test for that particular mutation in our RT-PCR, so we can potentially get false negatives. The 1A and 1B area you'll see on that left represents the polymerase enzyme, which, as I mentioned earlier, is the one responsible for viral replication and is the target of many of the antiviral drugs. An intact 3C gene is needed for replication in intestines, but 3C deletions do not, when the feline corona leaves the gut, are not necessary for FIP development. 7B deletions will occur as lab artifacts or even in natural infections. Why 7B is so important is that an intact 7B is necessary for replications in monocytes. But one must keep in mind that lab tests based on looking for 7B deletions are not diagnostic for FIP. Next slide. Okay, so the host immune system in FIP is critical. And so first what we'll do is we'll cover a little bit of basics about the immune system so everybody has a working knowledge of it. So humoral immunity involves an antibody response to a foreign material or antigen that's detected in the body. It's primarily driven by B lymphocytes. The cell-mediated immunity does not depend on antibodies for its adaptive immune functions. Instead, the primary cells are the T cells, macrophages, and the release of cytokines in response to antigens. The binding specificity between the major histocompatibility context of the host proteins and foreign antigens is essential for maturation and differentiation of our naive T cells into helper or killer T cells. So what happens when a helper T cell runs into an antigen-presenting cell? It releases a set of signaling proteins called cytokines. These cytokines activate the killer T cells and macrophages to move to that area to destroy that antigen-presenting cell. So that what you'll find later is where things break down when FIP develops. Now, immunity to FECV does not confer immunity to the FIPV, and the role of humoral immunity in protecting against FIP is still relatively unclear. One interesting point, though, that Dr. Peterson, you'll see the note there, natural resistance to FIP virus infection is decreased rather than increased by positive genetic selection. Next slide. Okay, so what I alluded to here, why the immune system is so important, is basically FIP is an immune complex disease. It involves the virus or viral antigen, antiviral antibodies, and complement. It develops from an inappropriate response to the feline coronavirus because of mutations in that virus. Cats that develop FIP mount a significant, yet ineffective, humoral antibody response to the virus, rather than the needed cell-mediated. The individual cat's immune system and this is the major histocompatibility complex is specific for each cat, and it may impact the cat's ability to clear the virus. It may affect the predisposition for a humoral antibody response. It may actually alter the production of the cytokines, such as the helpful one, interferon gamma, which enhances cell-mediated response, or it can even lead to a decreased suppression of the virus in the intestines by the immune system, thereby allowing increased viral replication, which predisposes the cat to FIP development because, as we said earlier, increased viral replication makes the occurrence of viral mutation more likely. And then there's also some chemotactic substances being released from the infected and dying macrophages. And so basically, it's the cat's own immune system response to the virus that is causing all the damage in the body rather than actually the virus itself. Next slide. So, what happens now, depending on what immune response we get. So ideally, if the cat's immune response is successful in protecting the immunity to FIPV, the following would occur. There would be a primary cell-mediated immune response. Infected macrophages would display the viral antigen on this cell surface to enable antibody-mediated or even cell-mediated lysis, resulting in destruction of the virus. The host would recognize the infected macrophages as foreign and destroy them. The cellular immunity would need to develop early in the course of disease with sufficient strength such that the clinical signs would not occur and virus replication would be stopped. Now, what happens if the cat's humoral antibody develops, but the cell-mediated response doesn't? Then most of the time, what we get is the effusive or wet form of FIP. Now, what happens if the cat has a strong humoral immunity response, but the cell-mediated is weak? Well, the virus is not completely eliminated, but is better contained. However, what we get is an ongoing virus replication and destruction, which over time continues, which is believed to result in the dry form or non-effusive form of FIP. So in those cats that develop FIP, it has been shown that virus replication in the macrophages appears to be very slow during the first 2 weeks. At around 10 to 21 days after the primary infection, which actually coincides with the appearance of virus-specific antibodies, there is a dramatic increase in the levels of macrophage infiltration, macrophage infection, viral replication, and viral spread. Now mutated virus has been distributed by macrophages throughout the whole body. Two possible explanations have been posed for this viral spread from the intestines into the systemic circulation, and they are that the FIPV macrophages leave the bloodstream and enable virus to enter the tissue. The virus attracts antibodies, complement is fixed, and more macrophages and neutrophils are attracted to the lesion, resulting in the typical granulomatous lesion seen. The other possibility is that there's a circulating immune complexes exiting from the circulation into the blood vessel walls, fixed complement, and that these antigen antibody complexes are recognized by macrophages, but are not, as they should be, presented to the killer T cells and thus are not destroyed. So the immune complex deposition more likely is at the blood vessel bifurcations. Next slide. So the next slide, so clinical signs. We see two cat, well, one looks, the black one there looks like he's shell-shocked, illustrating the swollen abdomen. Next slide. So cats with FIP can present with a wide variety of clinical signs depending on what organ or organ system is being affected by the virus. The effusive form tends to present more acutely when a person notices that their cat is all of a sudden having trouble breathing or the abdomen appears to be swollen. Now, with the dry form, things get a lot more complicated because most of the signs are relatively nonspecific, such as weight loss, anorexia, a fever that is unresponsive to antibiotic therapy, or a waxing waning illness in which the cat seems to be getting better and then relapses. As the illustration there for the ocular, we have uveitis. Some cats may only have ocular signs, the uveitis or an anisocoria. Others may only have neurological signs such as ataxia or seizures. And then what makes it even more problematic is many of these signs can be seen with other diseases, which further complicates the evaluation. Next slide. So how do we diagnose this? What can we do in the antemortem patient. Next slide. Okay, so the diagnostic evaluation begins with the patient's signalment, history, and physical exam. Earlier, it was mentioned that intact males may have a higher incidence of FIP, and we see it in cats 2 years of age and younger more commonly. So a thorough history can provide information such as, has there been a recent boarding, how many cats are in the household, any changes, that type of thing. So questionnaires filled out by the owner prior to cat's appointment are very helpful for this. And then, of course, a head-to-toe physical examination needs to be performed, remembering to look in the eyes in case there are ocular signs, listen to the heart and lungs, palpate the abdomen for a fluid wave, or the organ or mesenteric lymph node enlargement. And then the most favorite of the cat, a body temperature measurement. Next slide. So here's some possible diagnostic tests that have been shown to have a pretty good diagnostic accuracy when used for FIP. Now, traditionally, and this hasn't changed, definitive diagnosis relies on histopathological examination of the tissues, looking for the detection of the virus within lesions by immunohistochemistry for the feline coronavirus antigen. Now, we can also immunostain effusion samples for the feline coronavirus antigen if their biochemical and cytological features of FIP are present. So just a note, as we mentioned earlier, since feline coronavirus is an RNA virus, DNA is required to perform the PCR test. Therefore, a reverse transcriptase has to be performed, which is what the RT stands for in RT-PCR on the screen. However, RT can also stand for real-time PCR, so it's important to make sure that one understands which test is being run that is being sent off because they're different methodologies. So ultimately, diagnostic testing needs to be based on the cat's signalment, history, and physical exam findings. Typically, the baseline labs of serum biochemistry, complete blood count, and urinalysis may or may not be helpful when assessing for FIP. We do see approximately 89% of the cats have hyperglobulinemia. 50% will have lymphopenia. Many will be anemic. It is helpful to look at the albumin to globulin ratio because if it's greater than 0.8, FIP is less likely. And if the acute phase protein, alpha-1 acid glycoprotein level is greater than 3 milligrams per mil, FIP is highly suspicious. Now, if an effusion is suspected but not obvious, perform an AFAST, which is an abdominal fast ultrasound exam, or a TFAST for the thorax, because the purpose here is any diagnostic tests we perform on fluid samples have a significantly higher degree of diagnostic accuracy for FIP than any other sample type. The Revolta test, which you notice there in the slide, shows a positive test and these steps to how to do it, is an inexpensive in-house test that can be run initially on a fluid sample. Depending on whether it's positive or negative, additional testing on the fluid may be indicated, such as cytology or bacterial culture, or reverse transcriptase quantitative PCR, where we're looking for how much virus, if it's present, is in that fluid, or looking for the feline coronavirus antigen via immunocytochemistry. Okay, if no fluid is found, though, and FIP is suspected, an abdominal ultrasound may reveal mesenteric lymph node enlargement or organ enlargement, or even a characteristic granulomatous lesions, in which then we can do an ultrasounded guided fine needle aspirate or true cut biopsy sample, and then run those samples with a real-time RT-PCR testing or immunostaining for the feline coronavirus antigen. Ultimately, FIP must be diagnosed by applying a workable knowledge of the disease with a realistic assessment of the signalment, history, clinical signs, and laboratory findings. Next slide. This slide contains two FIP diagnostic trees. You'll see one starts with the cat presenting with an effusion, the other with a cat presenting with nonspecific signs. In the cat presenting with an effusion, the Revolta test is performed first. If positive, then a real-time RT quantitative PCR is run on the effusion, and there are fine needle aspirate samples taken from the liver, spleen, and mesenteric lymph nodes. It's very important to note that PCR testing on whole blood has very low diagnostic sensitivity, so is not a preferred sample, where if looking at using whole blood, look at the albumin to globulin ratio or the level of the alpha-1 acid glycoprotein. They will help provide a better assessment for FIP. So then, if one of our tests is positive, the samples are then tested for the spike gene mutation with taking into account the load of viral antigen in the effusion. Now, things are a lot more difficult for the cat with nonspecific signs. The diagnostic tree is very similar, except for the Revolta test is left out. Remember to use the same laboratory, and that determine the real-time RT-PCR tests have been verified and validated by the scientific community that they're using. The definitive diagnosis is extremely difficult to the disease itself, especially if there's no fluid or effusion present. To increase the index of suspicion of FIP involves strategically combining different sample types with various diagnostic testing methods, along with recognizing that for FIP, blood sample testing is of limited value. Now I'll turn it over to Dr. Thayer. Thank you.
All right. Well, I want to encourage you that, during this short break to consider texting CATS to 833-985-2287 to donate to the BRIA Fund. We have matching funds available, and we cannot really do treatments like we're looking at and other aspects, diagnostics, without financial support for the research. So, I do encourage you to think about donating. I've certainly been a huge supporter of the BRIA Fund and don't regret it one bit. Next slide, please. I just want to say hello again. I'm a fellow cat lover and cat veterinarian. You see me, my picture there with my Havana Brown, whose name is Bruni, and Brun is Norwegian for brown. I will do an overview of treatment of FIP, or a complex piece of the puzzle. Next slide, please. I want to say that FIP is now a treatable disease. I reiterate that concept. FIP is now a treatable disease. Many of you know this, but there are too many that do not. And I just saw an article yesterday out of the University of Sydney where they use the title, FIP is a treatable disease. An accurate diagnosis and starting treatment as soon as possible are paramount to giving any cat with FIP the best chance to live and be cured. This was said by Susan Gingrich, our BRIA Fund founder within the foundation. Don't delay starting treatment when a presumptive or confirmed diagnosis of FIP has been made. Many of these cats just have hours to days to live. One unpublished piece of information from research in another country is that the average general survival time for cats with effusive disease is 2 weeks, and with non-effusive disease, it's 5 weeks. Next slide, please. There are only 2 ways cats diagnosed with FIP can be treated and cured. We either find a way to stimulate a protective immune response with therapy or naturally, or we completely inhibit FIPV replication long enough to clear the virus from macrophages and or to allow host immunity to develop. Next slide, please. Supportive care is primarily what we've had to use in the past to treat cats with FIP, with a goal of offering support for comfort care and to sustain life, hoping some cats have some degree of a functioning immune system to control the virus. Up to 5% of cats treated in this manner could survive up to 1 year with supportive care alone. Now, supportive care is part of patient care alongside other treatments like antiviral treatment. Nutrition and appetite are crucial. Cats are carnivores and they need protein in their diet, and this should be good quality animal protein. Yet due to the immune effects of the virus and the presence of periodic fevers, many cats don't eat well. Finding a food that they will eat is important. Appetite stimulants like mirtazapine or cyproheptadine can be tried. Feeding tubes can be considered, though for many of these cats that are extremely ill, it's too stressful. Mirtazapine can be used to control nausea in these patients. Fluid support, again, is also important. The loss of appetite, a fever, or development of effusions can lead to dehydration. Using subcutaneous fluids at home, showing a picture on the right, or intravenous fluids in the hospital can help a cat to feel better. If they're still eating, hydration will likely occur due to the food intake, especially with canned food. We need to consider controlling the inflammation. Prednisolone can be used, particularly at the start of treatments, to control the inflammation, and it may help some cats to feel better and eat better. But it is recommended to wean off prednisolone during the once the cat is improving and undergoing an antiviral therapy. It is a controversial concept. We also need to consider whether we need to drain the effusions. Removing pleural effusion can help cats to breathe better, and removing the abdominal effusion may also decrease abdominal discomfort. But this needs to be used cautiously, since this is at the expense of body fluids and proteins, and abdominal effusions can return fairly quickly in some cats. We also need to look at managing pain and discomfort for patients. Such medications as buprenorphine can be used to control pain due to the inflammation and the presence of effusions, and many are using gabapentin also to manage anxiety, especially as cats go through, say, injectable antiviral treatment. Just keep in mind that sedation can occur, and we don't want the cats to become too sedated where they don't want to eat or drink. Next slide, please. Doxycycline has been mentioned for treatment use in cats. There's some thought that doxycycline has antiviral properties. There is a current study at Cornell University with Dr. Gary Whitaker to look at the benefits of doxycycline use. There is a regimen to give doxycycline at 1/2 the normal daily dose, along with prednisolone to treat in patients where, say, pet parents may feel that they don't have the funds to use some other type of treatment. And there are individuals that feel like that cats have responded to this treatment and got better. Immunostimulants are another, treatment method or consideration. Feline interferon omega. There are reports that some cats have responded to treatment with this medication. It is maybe starting to be considered, do we use this with some of the other antiviral treatments? But yet overall, I'd say key opinion leaders and FIP, infectious disease in cats, feel that it's not really been an effective therapy. Polyprenyl immunostimulant is a medication that has been used to treat upper respiratory infections. Dr. Al Legendre of University of Tennessee did a study in 2010 with PI on dry FIP cases. He felt that in a number of cases, the cats felt better. He stated there was overall an 8% effective treatment rate with PI used alone, less effective rate if it's given with prednisolone. It must be given continually over time as for like a chronic illness. And there are pet parents out there who believe their cats are survivors of FIP for a number of years. And with non-specific antivirals, there are a number beyond even what I have listed here: itraconazole, cyclosporin, chloroquine, which is an anti-malarial drug, and I'll be talking a little bit more about another anti-malarial drug later on. All these non-specific treatments have to be given at a higher and potentially toxic level to be effective. So they're probably not, top of the line as far as what we're considering. Next slide, please. Patient monitoring and record keeping are important, I'd say, for pet parents, and certainly veterinarians need to, will do this as part of their practice. This helps record changes, positive or negative, along with trends. The considerations to monitor the weight weekly. Weight gain is a key indicator for cats improving and responding to treatment. And laboratory tests are checked monthly. Also tracking activity levels and appetite. If a treatment is started, record the drug, dosage, and administration route, plus any changes along the course of treatment and observation. And this can oftentimes be done in a spreadsheet like Excel, and graphed. Next slide, please. This is an example of one person's spreadsheet record for a cat, which I think is very nicely done to follow the treatment response. Certainly the laboratory work is laid out on a spreadsheet, and by time and the results. There's also on the right what to look for. It doesn't show as well on the bottom, but the weight, weekly weight and date is graphed on this spreadsheet, and I want to give credit to Jenny Marks for sending her spreadsheet example so I could share this with you. Next slide, please. On antiviral drugs, I decided I probably should dedicate this to Dr. Niels Petersen, because he's certainly been so instrumental in feline medicine, and he's definitely given us a lot to talk about in this area. I enjoy looking at these 3D examples of viruses. This is an example of the spike protein where mutations occur, allowing FIPV to fuse with a cellular surface and enter the cell. This may not be a feline or FIPV rendition per se. It's probably more likely what's seen with SARS-CoV-2, which fuses with ACE receptors on lung cells. But this is where the mutations occurred that were determined at Cornell University with Dr. Gary Whitaker that allows cell fusion and integration into the cytoplasm of macrophages. Next slide, please. GC376, with its 3D appearance in the upper right-hand corner, is a 3CL viral protease inhibitor. These protease inhibitors inhibit formation of viral proteins, therefore inhibit proteases that process mature viral proteins. Antiviral Life Sciences is working to gain FDA approval of GC376 as a treatment for FIP. The timeline is uncertain at this time. I think they're hoping within the next 2 to 3 years that they will have approval, but we don't know. Certainly during the clinical trial study of GC376, patients with wet FIP responded better versus the ocular or neurologic forms. The compound was believed to not cross the blood-brain barrier as well for these non-effusive forms. This may change, though, once Antiviral does their clinical trials and they bring the drug to market. Next slide, please. This is the big one that we probably all eager to know more about, and that's GS441524, an RNA transcription inhibitor or nucleoside analog. You will see its chemical formulation, the upper right-hand corner. It inhibits formation of viral RNA, which results in RNA chain termination and replication stops abruptly. And we see that with the response to these particular drugs. A nucleoside analog such as this is produced by Gilead Sciences, and they develop these products or chemicals for the use in treating HIV, Ebola, and hepatitis C in humans. The GS441524 unfortunately is under their patent and licensing, and they have not allowed it to be available for veterinary use, and this is where things have gotten complicated. Remdesivir is GS5734. You see its chemical formulation in the upper right-hand corner, is a prodrug for GS441524. It has conditional approval for COVID-19 treatment in over 50 countries. We'll talk a bit more about remdesivir a little later. Next slide, please. As I commented at the start of my section, FIP is a treatable disease. Here are 2 cats who were treated, are survivors, and living a normal cat's life, pampered in my household. They live with a number of other cats. Smokey from the 2016 GC376 trial, who is a 5-year survivor, and Luna from the 2017 GS441524 clinical trial at University of California, Davis, who is a 4 years post-treatment patient. Dr. Peterson reports at this time with the GS compounds that there is at least an 80% cure rate, and thousands of cats worldwide who have been treated and cured. And I believe this past spring, he used the numbers of upwards worldwide of 15,000 cats. So I'll go with his number. Next slide, please. This is a patient from last year that was a patient of a veterinary friend and colleague of mine, and the kitty's name is Ridley. And Ridley is a effusive, more typical effusive form of FIP. You'll see on the lower left, he has pleural effusion. When he was presented, he had conjunctivitis and as I mentioned, pleural effusion. His weight was 6.1 pounds. He had a temperature of 103.1. He was anemic. His white blood cell count was elevated. He was hyperproteinemic, and his albumin globulin ratio was 0.2, which is quite low. A few days later, after I was talking with my veterinarian friend, Ridley started an oral form of GS. Shortly, about close to 2 months later, his follow-up lab work and weight was 10.6 pounds. His hematocrit returned to normal range. White blood cell count was normal. Total protein was normal, and his AG ratio had come up to 0.65, which is getting closer to where we like to see it. Next slide, please. These are pictures from just a few weeks ago with our handsome boy Ridley at 15, living the life of happy cat, and you can see that he's resting on a camp. The image on the right is with his conjunctivitis and ocular disease. He still has some corneal scarring present, but he's doing well, and his pet parent is extremely happy with how Ridley's life is right now. Next slide, please. So I'd like to have people consider, please record the disease and any changes in pictures and video. Certainly, prior to diagnosis, showing signs of the disease. And certainly if treatment is initiated, how the response and how their cat is doing. Documentation helps everyone learn from the disease and the treatment response, and ultimately, I think, helps cats. Again, photo credit to Jenny Marks for images of her kitty Heidi. Next slide, please. Non-FDA approved treatments. Yes, it's complicated because we're talking about black market drugs. What's the role of the veterinarian? Because these antivirals are not approved by the FDA, they cannot be prescribed, purchased, or dispensed by veterinarians. Many veterinarians choose to offer care and treatment support to cats with FIP, and I mean supportive care. Others choose not to because of the multiple jurisdictions and state practice acts covering the use of non-FDA or black market approved drugs. Certainly the article I mentioned from the University of Sydney that I read yesterday say that importing any of these products into Australia can be met with multiple fines and penalties. So, this is a concern for the veterinary profession to have to deal with. I do recommend, though, veterinarians discuss with their clients the risk versus benefit of current treatments and consider not making euthanasia the default option. Establishing a good veterinarian client-patient relationship. Veterinarians do want the best for their cat patients. It helps to go through a serious and life-threatening illness with your beloved cat having the understanding and support of a veterinarian you trust. Many veterinarians are utilizing informed consent as part of their patient undergoing treatment when they're doing supportive care or laboratory work. There are 3+ peer-reviewed and published studies, certainly many more on other aspects of FIP, but currently on the antiviral treatments. All have Dr. Niels Petersen as one of the authors. Their PubMed info and internet link is in the summary, symposium summary that the foundation provides. Except for the 2020 article on GS treatment of neurologic FIP, which came after we did the summary. Unfortunately, there's no centralized scientific database being maintained on cats treated for FIP. It's unfortunate that we're not capturing this valuable case and treatment data due to the lack of a central data depository like the NIH, CDC, or Johns Hopkins in the human field. All of us need to learn from our successes and our failures in the course of disease treatment. This is the only way that we know how to go forward. Next slide, please. I recommend staying up to date on this issue. Versions of GS 441, 524 labeled as dietary and nutritional supplements. The oral capsule form from one source is the active ingredient is labeled inositol, which is considered an extract of a fungus or a tree mushroom based on Wikipedia sources. These type of products are acquired through different online or non-veterinary resources, such as websites or social media like Facebook. Veterinarians definitely need to stay informed and review the literature. The paradigm is changing all the time. The methods of treating wet and dry forms of FIP, primarily the treatment is with oral capsules or by injection for 84 days, with a following period of 84 days being disease-free to state the patient is cured. The dosage to treat the ocular and neurologic forms of the disease is on the ocular form, it's about 50% higher on the milligram dosage per kilogram. On neurologic forms on milligram dosage per kilogram. I'm not going to give the dosage amounts. It should be in the paperwork or the handouts that you can download. And these GS can, with the effusive forms, cats can respond within, I'd say, 24, 48 hours, certainly by 5 to 7 days, and the non-effusive form oftentimes will show tremendous progress in 2 to 4 weeks. The medication's cost is based on weight and can be purchased in stages if needed, since it can be expensive. The photo on the left is a stock photo just showing different forms of medications. It's not GS itself. Next slide, please. Dr. Gogolski and I have often talked about how we really need to have a better understanding of the regulation of animal biologic products, because many veterinarians and many pet parents really don't understand how this operates. This is really a very kind of just short version, but the FDA CVM, or Centers for Veterinary Medicine, they regulate drugs such as antibiotics, antivirals, corticosteroids, and this is the process where it can take considerable funding, time, 5 to 10 years, to go through the regulatory process to get FDA approval. The USDA APHIS regulates biologics like vaccines or other products that work through the immune process, such as polyprenyl immunostimulant is approved through the USDA APHIS process. And in the human world, they can regulate and they do handle supplements, but in the veterinary or animal world, there's no such thing as a supplement in that consideration. They're regulated either as a food product or a drug. There is a website, that I have down there that tells more about supplements and how they're considered. And hopefully sometime we can have more information or another webinar to talk about the process of regulating drugs. Next slide, please. I've seen the question, some ask, why do we need to develop other treatments when we have such antivirals as GS that work? Well, besides the black market issue that we just discussed, there is the potential resistance to antiviral drugs. All the researchers at the symposium said there will be resistance developed to the antiviral drugs, much like we see with antibiotics in this current world. This is the reason they're working to develop additional antiviral drugs. HIV now utilizes 3 drugs to treat the disease. So consideration is if one doesn't work, the next one might, and if 2 drugs aren't effective, then the third likely will. About 3% of cats treated with a version of GS are naturally resistant to treatment with this drug. Prevention of viral replication comes from oftentimes targeting different sites like cell fusion, number one, replication and infection within the cytoplasm, number two, or the release of intact virus from the cell, number three, on that image to the left. And then oftentimes we don't think about the potential for low supply of base chemicals for these compounds. I believe there was one recent oral version that was difficult to get. It's common in the veterinary world where we oftentimes common medications that we use, we can't purchase them for patients because there's a manufacturing issue or difficulty in getting the base chemicals. I just saw yesterday that in Canada, they're going to have a supply shortage of sodium pentobarbital due to the fact that there's a manufacturing problem. And there's also the potential for interrupted supply chains for distribution channels, much that happened at the start of the pandemic where GS products were having a hard time coming through customs or being delivered to other countries. Next slide, please. The promise of mefloquine. Mefloquine is a antimalarial drug, and it has gone through laboratory trials of efficacy and safety against the virus in cell cultures in the laboratory, and now it's been going through clinical trial in Australia. The project, like I say, is ongoing. It looks very promising as it is approved for people. It is a more inexpensive drug. The brand name is Lariam, and it is hopefully if we get conditional approval after peer-reviewed studies and publication, that it be something that can be additionally available for cats. There was an article in DVM 360 in November issue, and you can see the information on an article about mefloquine. And again, I just read a recent article, additional information. I don't want to give the dosage at this time. I think you can find that out there. I don't want to encourage people to necessarily go and use it until we have more information available. Next slide, please. We do have, newly funded studies that were approved and funded from this spring. They should be starting soon. There are 5 studies that were approved. 2 are combined, and this is where I talk a little bit about remdesivir. There is a study, these studies will be looking at pharmacokinetics and safety and a clinical trial for use of remdesivir as a treatment for FIP. I just saw in the article yesterday, they've had over 100 cats now undergo treatment, and I think potentially they're seeing a 90% response rate. So I realize it's expensive, maybe a little bit difficult to get, but if this does get, essentially it looks effective and safe, we might be able to have a legal treatment that we can refer to and consider. -007 is a study out of UC Davis, combined antiviral treatment, and also additionally looking at pathogenesis of FIP. -010 is development of a CRISPR-Cas gene editing technique for FIP diagnostic testing using a dipstick test showing a color change line, which would be fantastic. This comes out of human research with COVID-19 and testing. And I just saw recently that they have developed much a similar type test to test for SARS-CoV-2 and companion animals. This is developed, I think, in another country. It sure would have been nice if they'd also work on one for FIP. We'd really love that. And -017, an immune stimulant treatment for effusive FIP. The research out of Colorado State University. This would be a similar type treatment to polyparental immunostimulant, but this additionally assists the development of interferon gamma, which is part of the immune support and need for cats to fight off FIP. This could be approved through USDA APHIS and be available in 1 to 2 years, a much shorter time frame. So something there to look forward to, at least for wet FIP cases. Next slide, please. There's not enough time available to cover prevention and management of FIP in multi-cat environments, though this is an important aspect of the FIP puzzle, and it's definitely an area I'm fascinated with. Dr. Gogolski did mention a little bit earlier. I recommend viewing the webinar from 2 weeks ago with Dr. Jacobson on shelter management of upper respiratory infections on Every Cat's YouTube channel. There was a lot of good information. Here are some pieces of information I'd like to share near this webinar's end, and that's that we need to, of course, avoid stressful situations which increase viral shedding among cats. You want to avoid overcrowding. Usually it's considered over 5 cats in a group you will start seeing more issues with shedding and disease. It increases the number of viral strains present, which increases mutation. Use good litter box and cat household hygiene. Most disinfectants are effective against FECV. Avoid other secondary health conditions like poor nutrition, secondary infections, and immunosuppression, and loss of passive immunity, such as with kittens and newborns, early weaning, loss of the queen, and gastrointestinal dysbiosis, or an upset in the microbiosis or microbacterial normal makeup community in cats. FECV-free environment is really not practical. There is a discussion and study talking about giving antiviral treatments for a short time to stop FECV shedding. The key opinion leaders don't necessarily feel that this is the best way to go because we can develop resistance to our antiviral drugs this way, and it's such a ubiquitous virus that shedding will occur again later. You can consider using bentonite-based cat litters. They show they decrease tracking and have some antiviral properties. One such we discussed a year ago is Dr. Elsie's Cat Attract. It's one to consider. Anything that potentially can decrease the exposure and shedding of FECV can be beneficial. Next slide, please. This is one of the very key piece of information that I really like to emphasize, and I strongly recommend the use of portals and low stress housing for groups of cats and shelters, rescues, catteries, and I even push it. I think it's excellent for veterinary hospitals to consider. And this is a portal, an opening that can be open and closed between 2 enclosures where the litter box can be on one side and can be cleaned separate from where the cat sleeps and eats and has its water. And there's a lot, they've found that infectious diseases like upper respiratory infections can decrease 90% if portals are added into the housing. There is the website where these can be ordered, or information about out of the Correct Shelter Medicine program at UC Davis. Virginia said she did put the link over in the chat, so it is there for you, but please check it out and give strong consideration to the use of portals. Next slide, please. Together, we will defeat FIP. We've come a long way, and there's still more to do. Yet people have called the antiviral therapies a miracle because we're seeing more than 80% of the cats treated for FIP going from the edge of death to being cured and back to being a normal cat in just months. Where else have we seen such an amazing treatment scenario for cats? So please join in high-fiving where we've got to this, and then also join in the colorful celebration with the cat on the right, who I was sent this photo from a good friend, this kitty just finished antiviral treatment and is celebrating in this picture. Next slide, please. Thank you to all of you who have attended today, and to our wonderful sponsor, along with great partners like CFA and TICA. Let's honor all the researchers, pet parents, and pet friends that are fighting FIP. And again, please consider texting CATS to 833-985-2287 to donate to FIP research. Let's meet the match of $2,000. Next slide, please. Again, thank you for attending. You can email your questions to FIP@everycat.org after the webinar. We'll do the best we can, try and answer as many as possible today. More handouts will probably come with the follow-up emails from the foundation on when the webinar will be available, to watch on YouTube, and including any race certificates for veterinary professional attendees. And now on to the questions.
Can I jump in just a second? I'd like to welcome Dr. Wendy Novakoff, who is our sponsor. She has joined us, and she would like to speak to the presenters for a moment. Your sound is off. You're muted. Better, go. Oh, still can't hear you. I'm not sure why.
Muted by the organizer.
There you go. Go ahead. That was my fault.
No problem. Dr. Thayer, Dr. Golgoski, thank you so much. As someone who was a professor in human medicine and who by necessity became very interested and involved in this area of research, I highly and sincerely thank you for your passion and appreciation for everything that you have done in the seminar today. I know we had a very good audience, and I am sure this will be shared widely across the many, many groups who are fighting FIP, either as parents or as people who are researching. I would also like to thank Niels Peterson, who is one of my heroes, who has graciously been communicating with me over this time as well. And finally, I just want to send out love to everybody that's fighting this terrible disease. And I hope that some of this information brings you some comfort. It wasn't anything that we did. There are so many reasons that we still don't understand why FIP happens. And we hope to continue that research so that we do understand it better. Thank you.
Thank you so much, Dr. Novakoff. Really appreciate your speaking up and sharing that information. I agree. Dr. Peterson is outstanding, and I don't think everyone understands all that he's done, for feline medicine beyond FIP, no question in that respect. So, well, we'll go through and I'll try and read off some of the questions, and Susan and I'll be less formal. Susan and I will, try and share answering. And let's see, Susan, one of the first questions is FIPV ever communicable cat to cat?
Thus far, that has not been shown. Basically, the FECV ends up mutating in the particular cat. So, at least fortunately, at this time, it does not appear to be between cats, other than via the shedding and then potentially mutating. Does that answer the question?
I think it probably does. I'd probably add to that in the sense that when you listen to Dr. Peterson talk and you read the research, that in most situations, FIP or the FECV and FIPV situation it's endemic in the group of cats, or a cattery or a multi-cat situation. But in some situations, because of that, the host factors, the viral factors, the environmental factors, that there's so much virus and so many of these strains that can be pathogenic, and the quasi-species, and with host factors of maybe increased susceptibility in some lineages of breeds, and the cat's immune system is overwhelmed, the mutations occur, so you can get epidemics, I guess is my point, that you can go from a enzootic situation to an epidemic situation where more cats in that environment, like in a shelter, it's been reported, you can see those, but that tends to settle down and go back to an endemic situation. Next question is, how often do multiple cats in the same litter get FIP? Is anything known as to why multiple members of a given litter get FIP?
I'm not quite sure on that. I think you covered some of that, Vicki, with what you were talking about was just the overwhelming load of virus and host factors all in one area. I think that is one of the mysteries as well, too, though, is that they can't predict. And so Dr. Peterson had done the work about genetic selection and basically found that trying to positively select for it increased risk. So hopefully that kind of covers. Do you have anything on that, Vicki, as well?
I would agree with you, Susan. The additional thing is time, time factors of trying to cover so much material in an hour or so, is that I am on the board of a cat shelter, and when I got even more involved in preparing for the symposium and into FIP information, I saw the fact of shelters, which groups of cats oftentimes would have more FIP cases break out, that's not the case anymore on well-managed shelters, because they're managing the environmental factors, smaller groups of cats, the disinfection, the portals, everything in that respect. And so they're oftentimes seeing, maybe they consider anything over one cat FIP case per 1,000 cats is a problem, and they usually have less. So I think that other, like catteries and rescue groups, if they follow similar principles, can oftentimes decrease the episodes where multiple cats in a cattery might show problems, with FIP.
Can I jump in and help with questions a little bit?
All right.
So one of the attendees who was a pet owner wants to know, one of the things that so many of us pet parents think and feel is that maybe we did something wrong that led to our cats getting FIP. Can you comment on that, please?
Okay, I saw that question, and no, I do not believe owners. I think everybody feels like, oh, what did I do? What did I do, wrong? And it's just unfortunately a perfect storm of these factors of virus and hosts and the environment that triggers, this situation where we get the virus changing tropism from being a mild disease, and we get the mutations, and it changes to infecting macrophages. So, I think almost everybody really tries to do the best for their kitties, and it really is not a factor of anybody should feel guilty, it's or bad that they've done something wrong. It's just the nature of viruses and our immune systems too. You want to say anything, Susan?
I think you covered that, really well. And just as a personal note, I ended up adopting a cat from I guess it was a hoarding situation, but eventually that cat developed FIP, and I can really relate to the frustration and the, what did I do? What should, that kind of thing. And I get basically, there's providing nutrition and the environment that we do. Sometimes there's just nothing we could have done to prevent it.
Thank you. So are there differences in the amount of FIP globally? An attendee asks, is it more common in some parts of the world? Because she lives in Spain and feels like they're seeing more of it than she would expect.
That's probably a difficult thing for me to say. I think certainly in some areas, it can be just how cats are handled, and the environment, different aspects, and there certainly could be different strains in different areas. I think that's something that probably could get back to, on this question and find out from some of our key opinion leaders. We have a number of people we're in touch with from over in Europe, and they might have an aspect about it. I know Dr. Peterson feels that the more in groups, the rescue groups and random bred cats are seeing more an increase in FIP amongst those cats. So I can probably say that, but I'm sure there are pockets, of different areas that we might see more FIP. Do you have anything to add, Susan?
No, I would agree with what you're saying, and that would, definitely something we would need to get back on. I almost there seems to be some even pockets, almost like in the United States and areas. So some of those aspects I think would be interesting to be able to understand better why that is occurring in those different locations.
Looks like we have a question from Orlando. Is there a relationship between FIP and COVID? Would a cat infected with COVID show the same symptoms as a cat with FIP? No, those are different in different families of coronaviruses because FIP is an alpha coronavirus, and SARS-CoV-2, I believe, is in the beta coronavirus line. And from what, the cell target for SARS-CoV-2 is respiratory. So there have been reports of cats showing up with COVID-19 type signs that's respiratory, and we don't tend to see respiratory signs with any form of either FECV or FIPV. You have anything to add, Susan?
No, I think that says it very well. I have not seen anything as well.
So a listener is asking if there is any hope at all that mRNA technology could lead to an effective vaccine.
It's, anything's possible. Certainly, probably one of the, if it's not a major company doing private research, probably the area and where Every Cat Health Foundation funding is at Cornell University with Dr. Gary Whitaker, and he's certainly looking at this. But anything in regards to vaccines, this sort of work is going to take a lot of funding. And so sadly, they seem to be looking more at SARS-CoV-2 exposure from cat to cat. And I would love to see them put that money into developing vaccine technology, in dealing with FIPV. But, it's being looked at. I just don't know when that will come.
Can you go into a little bit more about informed consent being obtained by the veterinarian? Is it something that's signed? Can you explain it a little bit more for the non-veterinary people?
Yeah, informed consent is essentially, and again, Susan can add to this too, all veterinarians, if you go through risks versus benefits on a procedure, or you discuss, what a disease does, or you do surgery, veterinarians want to communicate and cover, again, what you're doing, what are the risks, that sort of thing. And so you're communicating, and it's just signing when you're at a veterinary hospital saying, yes, you do understand and the risk versus benefits. And so I think in this area, it's worthwhile to consider that you've discussed and communicated and informed that you're doing supportive care and laboratory care and laboratory work, and you've discussed that part. It's a very tricky situation because some veterinarians feel that their regulatory agencies won't even let them mention treatment, mention the name, and I've seen people even say that they cannot. Some regulatory agencies do not even want them to do supportive care or laboratory work on a patient that is undergoing treatment. So I think it's just beneficial for communication and informed information, and that a pet parent signs that they understand that. Do you have anything to elaborate?
No, I don't think so. And it's very analogous to ourselves going in for anything anymore. There's a ton of forms we sign as to be informed, and hopefully as we move forward, it'll be more commonly offered as far as the pros and cons of the treatment and such, and more veterinarians will feel comfortable doing so.
Thank you. So this is like a two-part question from someone who actually has an FIP cat, dry FIP. And she says, my cat is being successfully treated with injections of GS, though he has not shown signs of neuro. Have you seen others up the dosage in the last 30 days to prevent a relapse due to neuro? And then also, once a cat is considered cured, what is the rate of relapse past the 84-day observation? Can it happen years later, or are we truly considered cured, or do we not have that information yet?
Oh, as far as like being successfully treated and upping the dose to the last 30 days to prevent a relapse due to neurologic, some people potentially have, usually they work with their, the administrators or moderators through the social media groups or the sources where they're getting these antiviral treatments. So I know that I mentioned to Dr. Peterson at one time, you know, the question about resistance and potential relapse. And he said, you know, because this can be a shift sometimes in immunity, and you'll see effusive disease going to non-effusive disease and sometimes shifting back to effusive disease, that he wonders whether a higher dose to start with may be potentially a benefit. But yes, I've seen some cats do get a higher dose, but usually people are waiting till they see that the cat is backsliding or some, you know, weight's changing, laboratories changing, and they're showing signs of disease reoccurring. And I get the impression relapses are usually within a short time of stopping. The 84 days of treatment can be restarted at a higher dosage level. I don't get the sense that after the 3 months of observation that they're relapsing. And usually if they're certainly out a year or several years like Luna and Smokey are, I did ask Dr. Peterson if he'd seen any episodes of relapsing, and you know, he had not, so, or at least I didn't get the impression he had. And any others, Virginia?
Is there a higher rate of success, wet versus dry, with the antivirals? Yes, no?
I would probably say the effusive form, yes, is easier to treat, and the ocular form potentially is a little bit, if you want to use the term, easier for you know, response to the antivirals. The neurologic form can be trickier because we do have the brain barrier and trying to get enough concentration of the drug over the past the blood-brain barrier and to be able to be effective, you know, in dealing with disease there. So yes, that can be, they can be potentially easier to treat. Do you want to say anything in regards to that, Susan?
Well, the only thing I would add is probably too, many of the non-effusive probably aren't diagnosed as early on, and so the disease tend to be farther along in the course of infection, and so that will complicate the response as well.
Thank you. All right, here's the loaded question.
Yeah, I do have the one that was sent in ahead of time, and I should, you know, read that one.
Yeah, go ahead.
My cat has FIP, the dry form, and he recently switched from injections to oral medication. He's been excessively shedding, which I understand is a side effect of the medicine. He vomits fur balls. Should I be concerned he's not getting the proper dosage of pills? You know, it is a complicated question on this one. I would first recommend talking with your veterinary professional, and then also the moderator or the individual you're working with as far as the source of GS on what they, you know, because they oftentimes are dealing with multiple cases and at one, you know, scenario over time, and can see a bit more what others are running into as particular problems. I suppose it can be a situation of concern because whether I believe the oral form is sometimes considered, as far as absorption, maybe potentially less effective, or it might take a higher concentration for the cats to absorb and deal with the disease in that respect. The drug was developed more to consider with injectable use. And it depends on whether the vomiting is shortly after giving, the oral form. The other things to consider: monitor any signs of relapse of signs, monitor lab work, and then in general, it's being a cat practitioner and practicing in California. We had a lot of clients that during the summertime would shave even short hair cats to decrease shedding and the ingestion of hair, and that can be beneficial if the cats don't mind the clippers and get too stressed out about that. But that's something to consider too if there's a lot of ingestion of hair. Anything you want to say, Susan?
No, I think you covered that very well. I don't have any other thoughts on that?
Okay.
Here's a big question. This is the loaded question of the day. How long is the typical FDA approval for some of the drugs to treat FIP? Is there a specific timeline we should expect?
Yeah, as I said with the GC 376, they don't necessarily want to be held to a specific time. I know last fall they were hoping for about potentially 2 to 3 years, but it can take millions of dollars and 5 to 10 years for a drug to go through FDA approval and all the, everything that needs to be done. So, some things can potentially be shortened, but they don't want to shorten it and affect the quality and safety of, a product. So that's really kind of how it can go. You can expect it can take a long time. USDA APHIS can be, as I said, 1 to 2 to 3 years, approval. So if something's approved on the human side, then they potentially can get conditional use, apply for that. And we might be able to have access, for cats with something that is already approved on the human side, but not the animal side. And we have peer-reviewed support, that this is safe and efficacious, for cats.
All right. So we're coming up on a quarter to the hour. There's still quite a few people here. Would you like to continue answering a few more questions, or it's up to you two?
I'm fine if people are still here. We can certainly try and go through as many as we can. So.
Okay. All right. Dr. Golowski, okay with you too?
Sure.
Okay. So this is a question. Can you speak a little about anemia in the dry neuro FIP cats? My cat has been on GS treatment for 30 days. He has shown improvement in neuro symptoms, however, has developed severe anemia 25 days into treatment and now has a fluctuating low-grade fever despite treatment. Is this normal?
That's a rather complicated question. What my concern would be is, is there something else manifesting another disease or pathology going on other than the neuro FIP, especially because of the the sign, it appears, sounds like the signs are improving, or with the not seeing the neurological signs. And then the only other thought would be is effect of the drug itself would be the two things. And so basically the provider should look into understanding what type of anemia it is, whether it's a regenerative or non-regenerative, and maybe have some ideas a little bit more, narrowing it down. Is it something else that's going on now in the patient in addition to FIP, or whether it is related more to the therapy? Vicki, do you have anything on that?
I would probably agree with your comments. I'd look for potentially some other disease process. I think that from everything that indication that GS is, fairly, really pretty safe. Of course, we don't, because of the black market nature, we don't always know what brands have the right concentration, quality, that sort of thing. So it can come down to, again, is there something else going on, and are we treating? So I tend to doubt the GS is a factor with the anemia, but I touch base with the source, your veterinarian, and the source where you're getting the GS compound, and see if they've come across any issues. But I've not necessarily seen any reports of that.
Okay, so this person has a cat diagnosed with wet FIP, and even after being on GS for 11 days, his belly fluid has not gone down. His second dose was somewhat missed a little bit, owing to the fact that it was her first time giving a shot herself, and some of the fluid came out. So she's wondering, could that be a factor, or can cats develop antiviral resistance?
They can develop certainly resistance, to the GS drug. It's not working. As I said, some small percentage of cats are naturally resistant to GS. I don't think they're going to develop resistance to GS, if it develops over time within 2 treatments. Either potentially the diagnosis may not be FIP, or, it just needs more time. Certainly looking at laboratory work can be beneficial. And again, I would talk with your veterinary professional, and then also your moderator, or the people that are assisting, and with your GS source, and discussing it with them.
All right, this is a great question. Are cats in pain with dry FIP?
I think they don't feel well. It's hard to say. I try and I feel like I can talk cats some days, but I just kind of look at their how they're feeling. It's certainly if they have masses, and that's putting pressure on other organs, things of that nature. Yeah, they probably can. And how much with the neurologic form, with lesions there? Do they have potentially headaches? Things of that nature. It's possible. It's sometimes you just have to either assume that they do or they do not, based on their behaviors. Do you have anything to say on that, Susan?
I think if we could really evaluate that, we'd be doing well, whether they're just, and I think we do rely a lot on their, how are they behaving, what their activity is. And I think that goes along with, if the supportive care can be very helpful. And so that's something one needs to really be cognizant of, because I think it's more of like, if they're nauseated, you know, we may not know that just by them, but other than their behavior. But then if we say give them something for, you know, for nausea, then all of a sudden they start running around and pure bright and alert, then we know that, gee, that was bothering them. So I think there's a lot of opportunity to help support them in addition to, you know, if you're treating specifically with an antiviral, other supportive care is indicated as well.
There are some resources online too to help you identify signs of pain in your cat if you're not 100% sure. If you want information about that, you can certainly shoot an email to us. Next question. This one's kind of an interesting question. Are there any studies showing a correlation between SARS-CoV-2, and is there any research that you're aware of?
I'm seeing an uptick of cases of FIP, and not that I'm aware of. There's different studies on SARS-CoV-2 in cats, you know, as far as that part goes, but I haven't seen anything in relationship to FIP.
In cases of genetic predisposition where there's a noticeable link in the breeding cat's family, would you say the kittens are born with a weak immune system? Can that be something that runs in the family?
I think there's still a lot that we just don't understand. I know, you know, Dr. Peterson has done quite a bit of work on that, and if they could actually identify, you know, particular genes or this and that, then they would have a better opportunity to try to avoid that, if you will, in the breeding families. But as I noted earlier in the presentation, is that they suppose there are some genetic predisposition factors, but risk factors, but they're still not very certain of what those are. Are you aware of anything, Vicki, on that?
No, you know, not yet. I think there, again, needs to be more done. I've certainly talked with Dr. Leslie Lyons, who's, you know, veterinary geneticist, good friend of Dr. Peterson's, and she still feels, you know, there's no breed predisposition. It's more a lineage issue. And the recommendation, I know that is if you see FIP, and especially it seems to come down through more the stud line, but if you're getting 1 litter or 2 litters that are developing FIP in a cattery, those cats, you know, the queen and the stud probably should be taken out of the breeding program. That's a recommendation. And I know Dr. Peterson also has in his paperwork said that if they've undergone GS treatment for FIP, he doesn't recommend utilizing those cats for breeding. And there is a recent study that's looking at physiologic phenotype in some cats or breeds, and I still am not quite sure how this all connects up, but phenotype with cats that are FECV shedders, you know, which may be more active, persistent shedders, and you could run into problems because of that versus ones that are non-shedders. So I think it's a little early to know what, you know, what the recommendations would be there.
Okay, here's an interesting question. Fluoroquinolones make drugs cross the blood-brain barrier. Is there any advantage to, say, example, administer an antibiotic of this class to cats known to have neurologic form of FIP?
This is a very interesting question, because this is one that is, is information being shared out there that sometimes I'm not sure where it comes from amongst, on the social media groups, and like what supplements or drugs not to give when cats are on GS, and the fluoroquinolones is one that said don't give with GS. And so I was kind of curious because I like to be science-based and go and get information. So I contacted, Dr. Peterson, and yes, because of fluoroquinolones sometimes having neurologic toxicity problems, they're not ones that you would probably want to use in this scenario. If you need to, you can. You certainly have to watch dose and which particular fluoroquinolone, but it's not one that I'd reach for.
Interesting question. All right. What type of neurosymptoms are commonly seen with dry FIP?
Just the more of the ataxia. You can see, some wheel seizure. I think what makes it difficult in cats in general is they generally don't have, quote, seizures like, say, their canine counterparts are, where they fall down and they're paddling and this and that. It's cats can have just some twitching, and that's their seizure activity. And so I think many times pet parents, or do not even recognize, because it may seem like, well, that's a little odd what they're doing there, but it's actually they had a seizure. So those are the common things that I'm aware of. Are you aware of any other types of things of presentation, Vicki?
They can have small multifocal, seizures. There have been reports of paralysis. And then certainly because the eye or the retina can be part of the neurologic system along with ocular, but blindness, things of nature like that, but usually kind of seizures and paresis, which is, weakness, things like that, are the most common. And I have seen reports where incontinence, urinary incontinence is seen with some individuals following some of the reports online. So that's a possibility.
Okay, this isn't a question. This is just somebody who wants you to know. I'm on my 4th day of treatment for possible dry FIP. Ultrasound is scheduled for Tuesday, but I just wanted to thank you for this webinar and information. I did not know about this possible treatment until my vet told me to find the social media group and do my research. I will be passing this webinar on to my vet. Thank you for all you do. That was really nice.
Yes, and thank you. And I'm like Dr. Novikov, tell people we want more people to know about FIP. A lot of people have let the paradigm, oh, nothing can be done. The paradigm's shifted and it is an issue. And so more pet parents, cat parents, and veterinarians need to know about, what's going on with FIP.
Well, and I think it's important.
Virginia, on anorexia and weight loss.
Yep. I'm coming back to that one. Yeah, I wanted to get the other one there. And just keep in mind too that for some understanding that there was, quote, a cure for FIP, they've forgotten that there's still a lot of work left to do, and that takes funding. So just everybody put that in your cap and keep it in the back of your mind. All right, anorexia and weight loss seem to be common symptoms of both forms of FIP. Do you ever see FIP cats continue to eat normally yet still lose weight?
Yes.
Okay, short answer, like that, yes. So that's not an unusual symptom.
Yeah, not for this disease, and probably for a number of others, but definitely not for this disease.
That's what makes it so difficult, because there's so many interrelationships with other disease processes that could be the same. And so, yes, it makes it very hard.
And the non-effusive form of the disease sometimes can take weeks to even months to slowly get to the point. At least years ago, we have more tools now, but to even be able to say, I think that's what we have. And so a lot of those cats can be good, not so good, with a non-effusive form. It can be very tricky at times.
Okay, so we're coming up on the hour. Let's say 3 more questions and then we'll call it good. And if your question doesn't get answered, please email it to fip@everycat.org and we'll try to get as many of them answered as we can. Quick question, if a litter is born to a mom with FIP, are the kittens at risk? And should they be taken from the mother to be hand raised?
Oh boy, good question on that. Certainly, she could be shedding virus. I'd probably read through that information on pregnant cats and FIP handout. That's probably one of your better sources that Dr. Peterson just wrote, and I'd follow the information there and go from there.
I have a quick question. If I understood right, the question was that the mother had FIP and had a litter of kittens. So
That's what the question looked like.
yeah, so the question would be did the mother survive? Or, in other words, that's kind of a unusual. One would suspect that did the mother really have FIP, or why is that thought, I guess, is what came to mind.
Interesting. If you do have some follow-up information on that person that asked that question, please email it and we'll see if we can address that a little bit more specifically then.
I definitely the handout though on pregnant cats that and FIP that Dr. Peterson mentioned.
Yeah, so if you haven't had a chance, make sure you download the handouts that are attached to the webinar. We know that there's a problem with one of them, but we're going to include that in the follow-up email. So don't worry about that, but please download the other 4. Many cats getting GS injections are saying that their cats get sores around the injection site. My cat has dry FIP and is on her last 30 days of injections. She's doing extremely well and only had a few sores in the beginning, but now more sores are showing up. Is there any information on what's causing the sores and why?
Do you want to answer that, Susan?
I don't know in particular. I do know that with many different types of injectable medications, that it's not uncommon over time to get local tissue reaction to the injections. And so hence the importance of varying where the injections are given. Do you have anything on that, Vicki?
I think, and probably more is with the social media groups, because they're supporting each other through a lot of, how to do these injections, how to deal with these injection lesions. I think you mentioned that sort of thing, but a lot of it is related to the pH concentration of the injectable material, that sort. So.
All right, quick follow-up. This is a follow-up to the fluoroquinolone question. How about administering fluoride, as this is actually what reduces blood-brain barrier permeability in order for GS to reach the brain tissue in higher concentration? any studies done on this? Again, for the neural form dry FIP.
I'm not aware of any.
I'm not either. And I guess the cautionary would be is before one does any of those types of things, you definitely want something to show that it's a safe practice, because if it, the implications could be devastating, you know, with the side effects.
Okay. This is a great question here. There are many vets in the U.S. who will administer the medication, while others believe that they cannot legally do it. Does this vary by state, or are licensing laws just not well understood?
Both. I hate to say it both, and I'm sorry to laugh. It does vary by state. We have state practice acts that 50 of them, plus you know, national, plus sometimes pharmacy laws. The human pharmacy boards can control what veterinarians do as far as dispensing medications that might come from human pharmacies if we have something, a prescription there, things of that nature. So it, and then individuals can, like I say, make their choices. They feel that, and I've seen this information that, you know, most issues may come from your communication, and if you were going to have a problem, it'd come from your client, you know, and difficulties there and their complaint to the state board, versus I don't think the state board, unless you're really blatant on something, is going to come down on you as an individual usually, but they can. And it can be tricky, and they aren't going to give us guidance. I've tried to ask for some in my state that could go out to veterinarians, and I don't think they want to even get into that dilemma.
Good answer. Any evidence that FIPV is passed through maternal milk?
Not that I'm aware of. Are you? I haven't.
No, it's fecal oral. So the virus is shed in the feces.
Okay, and this will be the last question. What is the difference in the GS brands? Some are $115 a vial and others are $65. I'm treating a 7 kg Maine Coon and he is gaining weight quickly. It matters a lot to me, the quality of the GS and the price. Are you aware of there being any difference between brands? Oh.
Yes, there can be. I certainly last fall, you know, Dr. Peterson shared some information about the concentration levels between some of the different brands coming out of China. So all you can do, that's a problem with a black market drug and it's not FDA approved, is that the quality and the level of drug, you know, concentration is not evaluated from batch to batch, brand to brand. So you usually have to check with the different, I'd say, social media groups and companies and determine. But there are a lot of different brands, and sometimes I see a new name pop up all the time for a brand, and I'm wondering where the heck these brand names come from. I really do. So what makes the brand name? But yeah, it's, you have to ask individuals their experiences, and unfortunately veterinarians may not know.
That's a really good question too.
It is.
All right. Well, we are now past the 2-hour mark. And so I'm going to say thank you very much to Dr. Vicki Thayer and Dr. Susan Gogolski. I hope that we can do this again, because I still think there's a lot of I think we should make this a regular happening because we get so many updates. But definitely, if you have any questions that didn't get answered, please email them to FIP@everycat.org. We'll try to get as many of them answered. And keep in mind, one more time, all of this information is not free. It takes funding, and every dollar counts. Right now we have the $2,000 matching fund for the BRIA fund, but keep in mind that every dollar, every gift that you give to the BRIA fund goes towards helping defeat this terrible disease. So I thank everybody for being here. I'm going to turn it back over to Dr. Vicky for the final goodbye. Thank you both, ladies.
All I can say is thank you so much from the two of us. We're still trying to be our own FIP warriors and get the message out, and especially to veterinarians as much as we can, and other cat lovers. But thank you, and have a great day. Thank you.
Great. Thank you so much for all your attendance. We appreciate it.